Michael Guest is with us this morning, of course, Congressman from the 3rd District, to talk with us a little bit about unemployment, what's happening in Mississippi, small business loans. We're hearing that they could be issued as early as next week. Good morning, Congressman.
Good morning, Ms. Linda. How are you doing today?
I am great. How are you doing? Are you holding up okay?
Yes, ma'am. I am. I've been back in Mississippi now for a couple weeks after we voted on the third stimulus package, and just been like a lot of your listeners working from home. But before I begin, I know you want to talk about the things that are going on in Washington. I just want to let you know that many people in Mississippi appreciate the work that your husband does. He has touched so many lives in Mississippi in such a positive manner, and the work that he does in the medical field, and has touched my family as well. And I just wanted to let you know how much we appreciate the work that he has done for so many and so many lives that he's been able to touch throughout his great career in medicine.
Well, Michael, thank you. That is so kind and thoughtful of you. I can't tell you how much that means to me. For those of you that don't know, my husband is Dr. Philip Lay. He is a surgical oncologist who primarily treats melanoma. Breast cancer, of course, is his largest practice. And so, Michael, thank you. That's very thoughtful. You know, we, like many families, have worried about those on the front lines. Although Philip has cut back his clinic and surgery schedules dramatically compared to what it would normally be, you can't stop treating cancer. Women are, especially with breast cancer, you find something during this time, it's very frightening, and you're not sure if you're going to be seen. And diagnostic testing has been basically wiped out right now for routine testing. And so everyone's life has changed. And of course, I worry every day when he comes home, what is he bringing home? They work diligently to protect themselves, but there are patients that come in that they don't know at the time they're asymptomatic, no symptoms, and yet they end up sick in a day or two, and they are COVID positive. So it's a very frightening time for a lot of us.
Well, and you're exactly right. And our medical personnel, our first responders, they are truly on the front line of the COVID-19 outbreak. Because everything you're saying is so true. So many people are not displaying symptoms, and so they're asymptomatic at the time that they may go into a doctor's office, or in which there's some sort of a medical emergency call for something unrelated. And we've got many of our first responders, many of our doctors and our nurses who are every day exposing themselves voluntarily to treat individuals who may be suffering from COVID, they may be suffering from other health-related ailments, and they are putting their safety at risk and the safety of their family at risk if they were to come back and contract that and spread that to family members. So I want to thank your husband, I want to thank all of our medical personnel, all of our first responders for their bravery and the things that they are doing to help us as we try to flatten that curve and as we ultimately are able to defeat COVID-19.
Well, and I think that's the thing when we look around, Michael. It's so easy to, look at all the bad things that are happening. And for folks that are impacted directly by losing a job or their small business, they've had to close their door because the business that they do cannot provide an essential at this time. All of us are in some way or another are impacted by this. And it is difficult for Mississippians. We're already one of the poorest states in the country. We have many folks that are already working paycheck to paycheck and still can hardly make ends meet. But even for those that are a little bit more blessed, even my husband and I, although he has an incredibly successful practice, we still worry about how this could impact us because hospitals.
Well, and I know you're worried about your employees, the people that work with your husband every day. We want to make sure that we're taking care of those friends and family around us. I tell you one thing that I've been incredibly proud of, just the way that Mississippi has kind of stepped up and has come together, throughout, the COVID-19 outbreak. You look at, we saw a story this week about doctors at UNC who were able to build ventilators through parts that they were able to find readily available here in Mississippi. We saw Mississippi State was able to retrofit 500 battery-powered ventilators. Ventilators generally used to transport people from one hospital to another, where they were AC, so they could be used continuously. Our soldiers at the 172nd have been working some with the State Department to help bring Americans home who were trapped overseas after air travel began to come to an end. And so, you see our governor, you see Dr. Dobbs from the Mississippi Department of Health, and some of the things that they are doing Again, we have been in Mississippi. If you look at our numbers and you compare those to, say, Louisiana, we had the latest numbers that I had from yesterday was just over 2,000 cases, and 67 deaths. And, of course, any death is one death too many. But then you compare it to our neighboring state of Louisiana. And Louisiana has 17,000 confirmed cases and 650-plus deaths. And so, I think as a state we're doing a good job of abiding by that social distancing that we were. We saw this coming maybe a little sooner than some of our other states, as Mississippi was one of the last states to get a positive COVID-19 case. And so I've been very encouraged by the actions of our state administrators, our state health officials, and the people of Mississippi as we are all in this together, because ultimately this will pass. Whether that be 2 or 3 weeks or 2 or 3 months, we will get through COVID-19, and then we will begin to reopen the country. We will begin to restart the economy. Kids will begin going back to school, and life will begin returning to normal once again.
The normal that we know. We're talking with Congressman Michael Guest this morning. We're going to come back from this break and talk about small businesses and unemployment checks. Those of you that are not working, I know that you're wondering, when am I going to get that check from the federal government? And what about those of you that have had your hours cut back? You're still working, but your hours have cut back. Your paycheck has been cut back. Maybe you've lost more than half of your pay, your weekly pay. Are you eligible for unemployment? Are there any benefits for you? We're going to take a look at those issues coming back. We're on SuperTalk this morning, SuperTalk Mississippi on the Gallo Show. I'm Linda Allen, in for Paul this morning. We'll come back with Michael Guest and address some more of these issues that I know are important to all of you out there in Mississippi. Linda Allen filling in for Paul this morning. Our special guest this morning at this hour is Congressman Michael Guest. And Michael, the things that are coming up right now that the Mississippians are asking, small business owners and those that are unemployed, when is my money coming? When can I get a loan, or when can I get that unemployment check?
Yeah, and the things you're talking about were things that were in the CARES Act that were just signed into law by the president, I guess, about 10 days ago. And so we're seeing those things move ahead very quickly. As it relates to the CARES Act, there are really 5 main components that Congress was dealing with. We talked about one of the things we wanted to do was provide money to small business. And we looked at doing that in 2 ways. One is that there were going to be a delay in the payroll taxes. And so businesses would not be required to pay in their 2020 payroll taxes to the federal government until 2021 and 2022. So those taxes have not been forgiven, but they've been deferred so that businesses will have more capital available. But the thing that also was put in there for small businesses were the payroll protection loans. And these are loans that are SBA guaranteed loans where small businesses of 500 employees or less go to their local banks. They apply for these loans. The loans are many of the loans have been approved, and we all will soon be, we hope as early as Friday, begin closing loans in Mississippi to get needed money and needed capital to our small businesses. The great thing about these payday protection loans is that there is a loan forgiveness component. And so if someone were to take out one of these loans with their local bank, then if that employer keeps all of his employees on payroll for the next 8 weeks, then any money that the employer has spent on employee salaries, health care costs, rent, or utilities, then they can apply to have that loan forgiven. And so that loan, or that portion of the loan that is spent for those particular activities would then be transitioned into a grant. And so the hope is that after we get past this 8-week period, that we have seen the leveling off, that we have seen economic recovery begin, and so that within a 2-month period that businesses will once again be able to reopen for business, that they will see the uptick as we're out of this shelter-in-place type of order. And so this is really a loan that converts to a grant to help small businesses during this next 2 months as many businesses have been forced to either close their doors or to greatly limit their hours and the things that they're able to provide. Another aspect that we really wanted to focus on was to help individuals who had lost their jobs. So many individuals, because of no fault to their own, have been laid off. We've seen record number of individuals nationwide apply for unemployment over the last several weeks, and we're going to see that trend continue. And there are currently at this time, there aren't going to be new jobs for those individuals to very quickly transition into. And so Congress, in the CARES Act, what we did is we increased the unemployment benefit that individuals are going to receive. And so unemployment is now going to include both a state unemployment portion and then a federal unemployment portion. That's going to be for a 4-month period. And so for the next 16 weeks, individuals who are on unemployment are going to receive an additional amount from the federal government. And again, the intent in that is we know that people, again, have lost their jobs. Again, they've lost their jobs because of a worldwide pandemic. We want people to be able to continue to pay their mortgage, to pay their rent, to pay their car note, to put food on the table for their family during this transitionary period until the economy is able to reopen and we're able to get people back to work. And so as people begin applying for unemployment benefits, the state, and I'm not sure they probably have already has to sign an agreement with the federal government, and that probably has already been done. And then they should start seeing, in addition to the state unemployment benefits that they're receiving, they should start seeing a federal supplement to that. And another thing that we looked at doing is going to be the stimulus checks or the tax rebate checks, which people are looking forward to receiving. Those tax rebate checks, if your bank account is on file with the IRS, those checks should begin, or those deposits should begin arriving, hopefully sometime late next week or early the following week.
And those are the checks Michael, that are $1,200 a person or $2,400 for a couple. Is that correct?
That's right. For individuals who make less than $75,000 net income, then you are going to see a $1,200 check for each adult. And then for children under 16 that are claimed by dependents by their family, that check amount would be $500. And again, so the hope is that we are giving people money that they are going to need to make it through this transition period until we can get the economy reopened. And my hope is that once these stimulus funds start arriving, that people will spend that money locally. That very quickly, I hope we will see restaurants reopen, that we will see businesses which have been shuttered because of the shelter-in-place reopen. And I'm hopeful that people will spend that money here locally. We'll see that money turn over in the economy several times here in our communities. And we will be able to very quickly rebound and see encouraging economic numbers in the very near future.
Michael, two things, one on the business end, one on the employee end. So if you're an employee who's in a small business and you've been cut back, you haven't been laid off, but you've been cut back. So you normally work 35 to 40 hours and now you've been cut back to 16. Are you eligible for unemployment benefits?
No, you're not going to be eligible if you're still working. You will be receiving the stimulus checks. And the other thing is that if your employer is applying for one of these payroll protection loans, and they've got to look at the average salary that they're being paid. And so the hope is that businesses who apply for and who receive the payroll protection loan programs, that they will then be able to transition those people back into full-time employees because, again, those employment costs will ultimately be covered by the federal government once these loans have then been transitioned into grants after that 8-week period. And so that was the intent of that, to make sure that we are, as a federal government, doing all that we can to ensure that people are not only continuing to work, but they're continuing to get as close to possible the hours that they are used to working, and that their check is going to be very similar to what they're used to seeing each month.
For small businesses that are going to apply, are there particular banks in the state that they need to go to, or are any banks available to let them take in an application? Most
banks are taking process in this, and so I just encourage them to call their local lending institution. Banks are not required to, but many banks that even don't do SBA-related work have begun to enroll so that they can give these loans. I don't know the exact number of banks in Mississippi, but I will tell you that the large majority of the banks are. So particularly all of the larger banks that I'm aware of in Mississippi are participating in this. So I just encourage all your listeners to please call your local bank, ask if they are participating in the payroll protection loans. If not, I believe that they can very quickly find banks in Mississippi. And the reason that they were using the banking system versus the SBA is to try to get this money out very quickly. So banks are used to lending money quickly. This gives many different locations for people to go to. And so we've already, again, started seeing loans being approved. And again, those loans should begin being closed late this week, and so we should be putting that money back in the hands of business owners. And it appears that the program is going to be so successful that Congress is looking at appropriating additional funds so that we can make sure that all the businesses that want to apply are covered. There was a $350 billion amount set aside for these loans. It appears now that is going to be insufficient, and so there is movement by Congress to add an additional $250 billion to that program so that all the businesses across the country who apply will be eligible and will be able to receive those funds.
Michael Guest, Congressman of the 3rd District of Mississippi, thank you for joining us this morning and kind of explaining some of that, hopefully giving some folks a little more hope about what's there. Of course, as we all know, nothing in life comes free. The question is going to be down the road is how federally and statewide are we going to pay back all of this money that's being doled out, and what will it mean for the future of Mississippi and for the United States?